My name's Joan Smith, and I live in Colorado. I'm in Colorado partly because of this disease that I have. Before I was diagnosed, I felt that the environment here would be healthier for me because I was having problems where I was living before. I think I've had this my entire life. I remember as a child having symptoms that later recurred when I got older. I did have kind of a reprieve, I think, in my 20s, where I didn't really have very many symptoms at all. In my late 30s and early 40s, I always say my disease went full blown, and it started in the middle of a night. I was awakened from a sound sleep with symptoms that later became diagnosed as systemic mastocytosis. It was a 16-year journey from that first episode till my diagnosis, and then a number more years before I have gotten treatment that has relieved many of my symptoms. It's a disorder of the mast cells. It's a genetically based disorder. Mast cells are part of the immune system, and they are charged with helping with healing, and they sometimes can induce inflammation or send lots of mast cells to one area to help with healing, and then they're supposed to die. And in this disorder, the mast cells don't die when they're supposed to, and they proliferate. So that's why it's called a myeloproliferative disease. And the cells, since they don't die and they're dividing all the time, they can build up in the bone marrow and in your organs and other various parts of your body and cause symptoms that over time worsen, often because there are too many of these mast cells. Then you can have too much inflammation, too many other problems, and it's a difficult disease to diagnose because the symptoms can mimic so many other diseases. Well, after I had that first episode in the middle of the night where I was awakened with GI symptoms, I looked in the mirror afterwards because I felt very hot, and I saw that my face was bright red. I had a rash across my chest. I also had tachycardia. My heart was racing. And I thought, well, maybe it was something I'm allergic to. I had always thought I was allergic my whole life. And I thought, well, maybe it was something I ate or something I did. And then I kind of forgot about it. 3 weeks later, I had another one. So I went to my primary care doctor, and he did some general blood work for me. When everything came back normal, he offered me a referral to a psychiatrist and told me that if he couldn't figure it out, no one else could, and that probably I should consult with someone about my imaginary disease that he thought I had. Not an uncommon story, I've come to find out. When I left there and never came back, I was determined to figure it out on my own, and I talked to my family who live in St. Louis. I told them I wanted to see an endocrinologist. And that was the beginning of my path through many specialties. I went to endocrinology, and the endocrinologist couldn't figure out anything, did all their tests. And then I said, well, where do you think I should go from here? And they said to go see an allergist. And so I went to Washington U in St. Louis and saw a pretty well-known allergist, immunologist. And he actually did a tryptase test, which is a marker for mastocytosis. And it came back negative, which my hematologist now says, I asked him how that could happen, and he said it was just a false negative, and if you had done it again, it might have come back positive. It saved 16 years of a lot of effort. But I did test positive for a lot of things that I was allergic to, and I think now that my skin just reacted to anything because of the mast cell problems. So he started me on some medications that actually did relieve some of my symptoms, but then as time wore on, my symptoms were getting worse and worse and worse, and the medicines were stopping working, and I was just not having much luck. And when we moved to Colorado to try to see if an environment change would help me, I started having a lot of body pain. I wasn't sure whether it was muscle or joint or connective tissue. I didn't know. So I decided to go see someone at National Jewish Health here. They're specialists in immune and autoimmune diseases, as well as pulmonology and some other specialties. I asked to see a rheumatologist, but they first put me in to see an allergist immunologist, and they drew a lot of blood. And when it came back, my tryptase was quite elevated. And I think it was maybe in the 30s then, and normal, I think, is under 10 or 11, something like that. And so, after 16 years of wondering what was going on with me, I had this diagnosis in 2 hours. And so the reason I didn't get it was that there weren't specialists who were familiar with this disease where I was living. Once I had the diagnosis, I was started on more medications. I was taking appropriate medicines, but they were not at a dose that was therapeutic. So I was started on more medications and more of the same medications that I was on. And I had pretty good relief for a number of years. I think there are a lot of symptoms that can indicate SM. As they got worse, I started having anaphylactic reactions, but they weren't typical anaphylactic reactions where you can't breathe and you start turning blue. Mine started with flushing and feelings of anxiety, and then I could get tachycardia. A few times my heart rate would go up to 160 or 170, and I was sitting on a chair. I was having to go to the ER 3 or 4 times a year to get epinephrine and steroids to stop the symptoms. So that's a pretty classic presentation. A lot of times people start out with more classic anaphylactic reaction. Mine was a little atypical. And when you don't have a diagnosis and you go to an emergency room, they generally are skeptical about what you're telling them, you think is going on. And so talking with my allergist at National Jewish, we decided the best thing was for me to say I'm having an atypical anaphylactic reaction, and then they could treat it. They knew what I was talking about and could treat it. So I think people who are having anaphylactic reactions, people are having many allergic symptoms but not testing positive for any allergies, that's a red flag, because our symptoms are similar to allergic reactions just from environmental things. And the biggest problem with mastocytosis is that everyone has a different set of symptoms. People can react to completely different things. I can react to mold, for example, and somebody else has no problem with that, and they may react to something else. And so it makes it harder to pin down when the symptoms are different for everybody. After my diagnosis, I did research the doctors who were studying this disease and treating it. And I went to see one of them who was in Michigan at the time. And then when we moved to Colorado, I called him and said, I'm not near where you are anymore. Do you know someone out this way who could treat me? And he connected me with Dr. Jason Gottlieb at Stanford. I started going there to see him. And over time, my symptoms were continuing to progress. The medicines weren't working very well, and I was having more breakthrough symptoms and not functioning very well. My quality of life was really low. So I told him on one of my visits that I really had hit the wall and I didn't know where to go and what to do from here because it was getting bad. And my tryptase level was rising quite high, with normal being about 10 or less. Mine was 191. And I was almost into the aggressive category of mastocytosis. There are several levels of it. And he said, I have something for you if you want to try it. And I, of course, said, what? What? And what are the side effects? He told me the name of the drug. At the time, it was a it was a clinical trial, and it was called Blue 285. Now it's called KIT, and it's been approved by the FDA. And I said, yes, I'll do it. To make things more difficult, it was the beginning of the pandemic, and we were in full-blown pandemic mode, and I was going to have to fly there once a month for the first year at least, and be exposed to whatever might be on that airplane or at that hospital. So there was a little stress involved in it, but I was at the point where I really wasn't able to function very much at all. And so it was worth it to me to take the chance and try it and see what happened. So I started on the trial. I think it was half the people got a placebo and half the people got the drug. And so we didn't know how long it would take for it to take effect. And I knew some of the basic side effects that some people get, and, just to kind of watch for those. And after 2 weeks, I woke up in the morning. One of the side effects of the drug can be periorbital edema, swelling around the eyes, and redness in your eyes. And I woke up one morning and my eyes were all swollen. And I went to my husband and I said, I think I'm on the drug. I'm really excited. I think this is not the placebo. Before I started on it, in the evenings, like 6 o'clock, I couldn't do anything else. And I was on the couch, usually falling asleep, and I was done for the day. And about a week after my eyes started swelling, I noticed that it was 10:30 at night, and I was in the kitchen puttering around, standing vertical. So I was pretty excited about that. I know most people aren't excited about being up at 10:30 at night, but I was. Then my symptoms started to decline over time, and that was really the only thing that was left for me. There are other drugs for systemic mastocytosis, but it just happened to be a really good fit for me, and slowly over time most of my symptoms have resolved. There's still things that take a long time to maybe get over. A lot of those are psychological. The fear of having the anaphylaxis somewhere where you can't get help, fear of not having your medicines with you. There's a process of, and I think this is maybe true with many rare diseases when it's taken you so long to get diagnosed, that I think once you get treated, you have time to kind of grieve the time that you lost while you had this disease, and you had not much of a life, and you weren't able to do the things that you had really always wanted to do. And I think so some of that maybe doesn't go away completely. Well, if they're diagnosed, I look at how you were diagnosed and who diagnosed you. Was it a general practitioner, which would be rare? Was it someone who is very knowledgeable about the disease? I think that you should go to an expert who treats patients with mastocytosis, who understands the processes and the treatments, and find out what might help you the best. I think it's also good to get online and look for support groups, become aware of what triggers your symptoms. And that's really important because everyone has different triggers. And, most people try changes in their diet, or they try changes in their environment and avoid things that they know trigger them. You have to be aware of what happened right before you started getting symptoms, maybe in the day before. So become aware of your symptoms and do as much avoidance as you can. Be discerning about what advice you take off the forums. People are really quick to change your diagnosis or to give you advice that really doesn't apply to you. I think learning to manage it as best you can, and then getting expert medical advice on medications and treatments that might be available to help you. And not everybody has the same response to the drug that I was on or other drugs. I think that in the clinical trial I'm on, the average was for people to have a 50% relief in symptoms, which may not sound like a lot, but when you're completely debilitated and then you can function better most of the time, it's a lot. Probably in any disorder that you recognize in yourself, you know the symptoms, you know your body, and you're the one who knows it the best. And it's exhausting to try to find a diagnosis. And that's the hardest part because you're exhausted by your symptoms, and then you're exhausted by the search, and then you run into dead ends and you get discouraged and go back to square one. But take a break from it, but don't give up. Continue on. Look for the experts. Look at your symptoms. Think about what specialties might treat someone who has symptoms to do with your lungs or your skin or whatever it is that your symptoms are showing. And once you get diagnosed, then find the experts who are doing the clinical trials and who are administering tested drugs, and take a chance because it might be the thing that changes your life again. There are a lot of doctors who I've run across, and not just ones I've seen, but other people. And the implication is often, you need to see a psychiatrist, but also that maybe you have Munchausen's syndrome. It's very rare, and it's probably more rare than the rare diseases. And so a lot of doctors will assume that you just have anxiety, and so you're going to all these different doctors to try to help your anxiety, but really there really probably is something wrong. I used to meet with interns. I had a doctor who was supervising interns, and I always told them that you're going to get a patient sometime who comes in and they have this constellation of symptoms that you can't figure out, and you don't know why they have them, and they don't seem to make any sense to you. But the number one thing is believe your patient and refer them to the specialist you think might be the best person to try to help them get diagnosed, because Munchausen's is rare. I think mastocytosis is underdiagnosed because people tend not to know how to test for it. I think doctors even, they've told me that they have two lines in a medical book that they kind of remember that name because it was so unusual, but nothing else.